Hi, I'm here with Mark, who's interested in giving his opinion on healthcare reform. Hi, Mark. How are you today?
I'm doing well, thank you.
Thank you so much for interviewing with me. I appreciate it. What are your opinions on the healthcare reform today? Are you for or against?
Well, I am for health care reform, but it has to make sense. It has to work. It has to be regulated by the market and not by a government bureaucrat.
So you are not in favor of overhauling our system. You're in favor of health insurance reform.
I think we could do some health insurance reforms like portability, making sure that people with pre-existing conditions are not denied care, the kinds of things that insurance companies get away with that should really not be allowed. Those are bad business practices, and they harm Americans. I'm totally against that. So I could see us making changes like that.
So rather than overhauling our healthcare system, you would rather overhaul the laws and regulations for health insurance?
Yes, indeed I would. I think we have to make health care driven by the market rather than by hospitals, doctors, and insurance plans. The only way you're going to get costs down is to put health care in the hands of the consumer. If a consumer doesn't know what it's going to cost for him to go for a test, he's not going to know whether to go across town for an MRI or to go to a hospital where it may cost more. Same thing with blood tests or even getting prescriptions. How do we know up front what the cost is going to be for those procedures? And if we knew we had a limit as far as what we could spend for a year, and we consciously keep ourselves under that limit, and the government said, you've been a good consumer of health care this year, we're going to give you a refund. That would be incentive for the consumer to spend less, to take better care of themselves so they didn't need health care, and would help us with our spiraling costs. Because when people view it as an entitlement, costs are going to go up. There's no way. That's human nature. You can't stop that. But if it's in their personal interest to watch and count their pennies as a healthcare consumer, it will help get costs down. But I don't see anything like that in the current plan, so I'm against it.
Thank you so much. How about with Mr. Kanjorski, Mr. Kasky, and Mr. Spector? Do you feel that they need to hold a town hall here in Scranton, Pennsylvania for the people here?
Oh, I'd like to see them in person come to town and explain how they can allow a fifth column to come into health care that's going to allow payment for abortions under a government-controlled plan. I don't think there's any Americans that are in favor of that. I think they need to answer that question in particular.
Well, thank you so much for taking the time out to interview. I appreciate it. You have a great day.
Thank you, Lorraine.
Well, there you have it. A little bit for, a little bit against. He has some ideas, and let's see if they get implemented.